If we're not saying to ourselves, I can't believe we just did this, I can't believe we're making this change, we're really doing things differently now, then we're not doing enough for climate change.
UCSF emitted nearly 100,000 metric tons of carbon dioxide from 2012 to 2019. The healthcare sector in the US is responsible for 10% of our national carbon emissions every year. If the healthcare sector was a country, it would be the 9th largest emitting country in the world, and emissions continue to climb.
We are at 1.0 Celsius above pre-industrial levels now. At the current rate, we will reach 1.5 Celsius in 8 to 12 years. At 1.5 Celsius, we will see an increase in severe weather, drought, food shortages and famine, disease vectors and spread of tropical diseases to the north and south, negative health outcomes for humans like infectious disease, pulmonary disease from airborne pollutants, and deaths from drought, storm injuries, heat stroke, and fires. Sea level rise, ocean acidification, and melting polar ice. Damaged ecosystems, some irreversible and unforeseeable impacts. And even though the poorest regions of the world cause the fewest emissions, models project that they will bear the greatest costs, a terrible inequity that we must prevent. Changing the infrastructure of producing emissions doesn't happen overnight, but it must happen fast. The time to kick the can down the road is over. Now is the time to look hard at what we're doing and rapidly plan and implement dramatic cuts to emissions.
These emissions come from many places. There are power plants on our campus that use fossil fuels. For instance, the Parnassus Central Plant emits close to 50% of all UCSF's carbon emissions. There are anesthesia gases, refrigerants, and the amount of plastic used in our hospitals and clinics, which is made with petroleum and emits greenhouse gases when it degrades. The jet fuel burned during travel to conferences and meetings, and the gasoline burned when employees, students, and even our patients used to commute to hospitals and clinics. The meat of animals like beef and lamb in our cafeterias and restaurants, all of these are warming the planet.
We learned a lot in the past few years about how quickly we can change. Change is possible, change is necessary, and change needs to happen now. Excellence in healthcare is no longer just about achieving incredible health outcomes. UCSF is already great at clinical care. Excellence today means taking control of our impact on the planet and holding ourselves accountable as an organization.
UCSF's health mission makes us acutely aware of our institutional environmental impact. Over the past 10 years, we have focused on increased energy efficiency. Now, UCSF is committed to eliminating fossil fuel use and in helping the University of California system and the state of California reach our collective environmental goals. We have made great strides in the last few years towards decarbonization. We have reduced our use of high-emission anesthesia gases, we are transitioning to low-emission refrigerants, and we're starting the switch to electric vehicles. Our new UCSF Bayfront Medical Building and Illinois Street parking garage will be fully electric, and we are planning more all-electric buildings such as the new hospital at Parnassus Heights and the Parnassus Research and Academic Building. We are proud of what we have accomplished, and we know there is more to do. UCSF will continue to address our energy reduction projects, LED lighting, building controls, and other energy-efficient measures such as electric heating and cooling. What is different now is that we will be moving to the next stage of our strategy. We are spending the next year studying the overall UCSF electrification plan, including the future of utilities at Mission Bay, UCSF Fresno, BCH Oakland, as well as a deep dive into the removal of fossil fuels from our current Parnassus power plant. We will share the results of these studies with you. There is no one solution to the problem, and it will take each person and all of UCSF working together to drive change.
We live in one of the richest cities, in one of the richest states, in one of the richest countries in the world. Do we think it's fair to pay others to cut their emissions so that we can keep polluting? Are we living up to our values as health professionals and as an institution? Buying carbon offsets while continuing to pollute is the reality of so-called carbon neutrality. I would argue that zero carbon, that is, producing no carbon emissions, is what allows us to live up to our values.
According to a Pew Research Center survey, 60% of Americans believe that addressing climate change and reducing emissions is important, even when it means redirecting resources from other purposes.
We at the University of California have taken substantial steps towards this. UC has completed over 1,000 energy efficiency projects. Only since 2019, UC Clean Power has provided carbon-free electricity across many campuses and health centers. 89% of UCSF's electricity is carbon-free. We have $72 million focused on carbon reduction projects in the pipeline. And we are involved in a $1.5 million decarbonization study to provide a timeline and budget estimate to meet the new 2045 decarbonization targets. We have phenomenal expertise on climate change and health right here on our campuses. In just the past few years, we have become home of the UC Center for Climate Change, Health and Equity and the UCSF Earth Center, which specializes in the study of harmful environmental exposures.
What we need now is the active engagement of faculty, staff, students, and administration to make changes at every level in which they operate. We need full commitment to rapid, major reductions in emissions and the behaviors that contribute to those emissions.
I want you to think about the idea of allowable emissions as having a half-life, and we've just discontinued them. We need to cut our emissions in half every 2 years. That's how we'll get to zero carbon. That's how we'll avoid an increase beyond 1.5 Celsius.
We're not going to tell you how to do it, but we are here to help. There are straightforward ways and creative ways to achieve it. This is an opportunity for creative innovation, collaboration, sharing ideas, experimenting, changing how we do business and relate to our work. This will change how we work, but it's already going to change. There's no question that this is a crisis that will define our lifetimes.
We have a choice in how we respond. Do we want to be on the vanguard, set an example, and lead others to achieve this too? Or do we want to lag behind? Some of you have thought about this and may already know what you need to do. Some want a little more information. If you would like to learn more, please visit the sustainability website, which you can access through this QR code. We have resources available to help you understand your carbon footprint and what you can do about it today.
There are so many ways to get involved. There are committees to join, organizations to support, and policies to advocate for. Some of you hold purse strings and make decisions, large and small, that will dramatically affect our chances of success. Some of you lead hospitals, clinics, societies, and community-based organizations that can make choices that dramatically cut greenhouse gas emissions. Every day your choices impact the climate. If you're listening to this, you have real power to create this change.
One incredible way to get involved that everyone has access to is simple. Start right where you are. Form a group in your program, department, or school. Work with your colleagues to make a zero carbon vision and action plan and bring it to life.
The more aggressively we cut our emissions, the faster we stabilize the climate of a very important patient, the Earth itself, and protect the lives of all who live upon it. We can no longer advance health worldwide without it. Thank you.